New parents in India or couples who are planning to have kids often wonder where to get their child vaccinated, either at government primary healthcare center or at private hospitals. Other than the cost effective vaccines offered by government hospital or the personalized care provided by the private hospital, there are certain differences that every parent should know before vaccinating their child to ensure their safety. In this video, I will detail on some relevant differences between government and private vaccines so that parents can understand the differences better and vaccinate their child. I will also share my opinion on where to get vaccinated for each of the vaccine. So let's get into the video. The first and foremost thing everyone should remember is both government and private vaccines are same in terms of safety, efficacy and quality. Other than that, at private they use single dose vials, whereas in government they use multi dose vials. A vial is a bottle where the vaccine is kept. So in single dose vial, the amount of vaccine that is present in it will be exactly the same amount that's to be administered to one child. In multi dose vials, the same vial can be used to vaccinate 3 to 4 children. For example, if zero point 0.5 ml of the vaccine is to be provided for a child, then single dose vial usually have only zero point 0.5 ml. So you take whole of the vaccine, you administer to the child and then throw it away. Whereas in multi-dose vials, you have 3 to 4 ml. So from that you can vaccinate 6 to 8 children. Now, I want to emphasize that there is no contamination issue possible at multi-dose vials because for every child they use single-use syringes irrespective of the hospital. So the contamination issues have not been reported and there is no need to worry about it. However, manual error can happen while taking the vaccine. So they can take a little less or little high, which can cause some underdose and overdose issues. The other major difference between government and private vaccine lies on the vaccines that are provided at 6th week, 10th week, and 14th week. These vaccines show robust symptoms such as very high fever, rash, fussiness, and swelling at the injection site. However, these symptoms are very temporary and they last for only 3 to 4 days. In extreme cases, anaphylaxis, that is severe allergic reactions, or febrile seizures that usually happens with high fever can occur, but it happens only at newborn babies who are born premature or babies with very low immunity. In a healthy baby, these conditions usually does not occur. So usually pediatricians recommend newborn babies who are born premature or the babies with very low immunity to get vaccinated for these vaccines at private. Because at private, there is a less painful option available. However, it's quite expensive. The cost ranges from 8,000 to 9,000 rupees. Usually, you won't get any swelling or any rashes, and the fever will be very low grade as well as some fussiness will be there for 2 to 3 days. So, what causes the difference in these 6th week, 10th week, and 14th week vaccines? In government, they give it as DTWP, whereas at private, they give it as DTAP. Well, these are quite the same, except the one which is given for pertussis. Pertussis is nothing but whooping cough, and at government, they usually give wholesale pertussis to vaccinate the child, whereas at private, they give the acellular pertussis. So both offers the same protection. However, the inflammatory reaction is a little robust for wholesale pertussis, which causes the higher fever. The rest of the vaccines for diphtheria and tetanus are quite the same. I also want to point out there are two other vaccines that are given along with it, and hence it's also called as the pentavalent vaccine. So, and those vaccines include hepatitis B and Haemophilus influenza type B virus vaccine. Another difference is the vaccination schedule between private and government hospitals. At private hospital, they usually offer flexible charts and they usually share personalized opinions like which vaccines you can omit or which vaccines you have to take. Whereas at government hospital, they offer only limited vaccines and the schedule is pretty clear. You have to get it all the vaccines that are in the schedule. These are some of the vaccines that are only present in private hospitals and they are not administered at government hospitals. Those include the typhoid vaccine, chickenpox vaccine, hepatitis A vaccine, and influenza vaccine. I have also mentioned the timeline of when to give these vaccines. For influenza, it is given at 6th and 7th month, a booster shot at 7th month, and hepatitis A vaccine is given at 12th month, chickenpox at 15th month, and typhoid at the 6th month, along with the flu vaccine. Another interesting vaccine that is given at both government and private hospital is the MR vaccine, except that in private they give it as MMR. So this MR vaccine usually protects against measles and rubella. However, this MMR includes another vaccination which is the mumps vaccination. The importance of mumps vaccination can be understood if you know what mumps virus causes. It causes meningitis, which is a brain inflammation, and infertility. This brain inflammation, if the child gets, it can lead to lifelong consequences. And the infertility problem also relates once the child becomes an adult. Hence, getting vaccinated for mumps is pretty important. There is another interesting vaccine, which is the influenza vaccine. You will be seeing that vaccine at every year in the private hospital vaccine chart for your child, at least till 5 years. Well, is it important to get this flu vaccine every year? I would say that it is very much important to vaccinate your child for flu till the child becomes verbal and begins to take care of itself. Whereas in case of adults, we do not have to vaccinate. Now, a lot of people misunderstand the flu as cold. There is huge difference between those two. I will talk about that in another video. However, I would say that it is very much important to vaccinate for flu till the child becomes verbal. So the first vaccine, BCG, and the oral polio vaccine that is given at birth. The vaccine is given at both private and government hospital. However, the vaccine is given 1 day after birth and you are not consented for this. So it is a compulsory vaccine and the hospital will take care of it. You do not have to worry. The next three vaccines, which are the 6th week, 10th week, and 14th week vaccines, are given at both private and government hospital. As per the previous discussion, the only difference lies on the pain level or the symptom level after vaccination. So I would suggest you to get it from government as it's cost free and also the safety and efficacy quite the same at both the places. Then comes the 6th week typhoid and flu vaccine, the TCV and flu. So it's not given at government. I would recommend you to get it from the private because the flu can get serious in children. The flu causes very serious symptoms such as blocked nose. If your child is not verbal and it can't explain you, the blocked nose can cause some breathlessness issue in the child. There is a booster dose for flu at 7th month, so kindly take that as well from the private. Then comes the 9th month vaccines, which include the MR, OPV, FIPV, and pneumococcal vaccine given in the government, and the MMR, OPV, FIPV, and pneumococcal given at the private. As MMR is given in private, I would recommend to get that from the private hospital. Then at 12th month, we get have the hepatitis vaccine and the meningococcal conjugate vaccine. Well, this is only given at private. However, the hepatitis A1 and MCV2 are usually recommended for people who are at risk of getting the virus, especially if the area with high rates of hepatitis A virus is there. The pediatricians in that area usually recommend to get the Hep A1 virus, Hep A1 vaccine, and in case of MCV, it is usually suggested for kids with weak immune system due to immunosuppressing medications or if they have HIV or spleen conditions. So it is basically your choice whether to get it or not. If you have a healthy child and if the area is not much affected by hepatitis A, but if you want, you can also take the vaccine at private because if you get it, you are well protected. Again, it is completely your choice. Then the 15th month vaccine, again it's PCV-B1, which is similar to pneumococcal, it's for pneumonia, and varicella vaccine is there, which is for the chicken pox. This is also quite similar like hepatitis A1. If the area is at very much risk to get catch chicken pox, then it's better to take this vaccine, else it can be avoided. At 18th month, you are given the DPT booster, OPV and MR. So they are given at both government and private. We can take it from the government. Then at 2 years, you are given the varicella 2, hepa 2, influenza vaccine and MCV. If not any other vaccine, it's really recommended to take the flu vaccine at the private. And at 5 years, the DPT booster is given by the government, and the influenza vaccine and DPT booster is given at the private. It's better to take the influenza vaccine. However, at 5 years, a child will be verbal and they can take care of themselves. They will tell you the symptoms and they will obey whatever you offer. They'll be taking the medicines. So, no need to take the influenza vaccine at that year. Also, if the child has been taking the influenza vaccine in the previous years, at least till 3 years, then that protection also will be offered a little bit for the child. So, we can take the DPT booster from the government. Now, these suggestions are based on some published research and from various groups, and also based on the discussion with my pediatrician. This can be changed according to your convenience. You can also discuss with your pediatrician. However, this can be used as a reference chart for a safe and effective vaccination. I want to affirm you that all the vaccines from government and private sector are regulated. So they are the CDSCO is a panel expert committee which regulates these vaccines, and they are all the vaccines that are provided in India are completely regulated. So we do not have to worry about their safety. I hope this video has clarified some aspects between government and private vaccines for you. I will just summarize that at government it is pretty cost effective and also widely accessible, except that the limited vaccines are only available and the chart is pretty clear, and it's only one for the whole country. Whereas at private, the things are a little convenient, and also you will have personalized opinions from your pediatrician, and there are some painless vaccines available. I also want to say, when I say painless, I don't mean when the child is injected it will be painless. The pain will be there. The injection pain is same for both the vaccines. The after effects, the symptoms post vaccination varies between government and private. So, with this, I just want to conclude that kindly vaccinate. So, I don't want to go into scientific details behind vaccination, but when you take a vaccine, you are given protection against that disease. Even if it's not a complete protection, the symptoms will be very minimal if you catch the actual disease, and it will not affect you like it should. So, kindly take vaccination to prevent against common illnesses, and also follow the appropriate schedule. Always take it at the right time. Like if you have to take the DPT booster at 10th week, then kindly take it at 10th week. Do not take it later, or do not rush to take the vaccine. And if in case you cannot get the vaccines from private, at least get all the free of cost vaccines from government and follow that chart. It is very essential for disease prevention and for a healthy child. Now, this is a link which will also share in the description. You can check it out. There are a lot of answers provided by this expert committee, and you will have questions answered. Like for the questions, what if I miss this vaccine? Can I take it the next week? What if I miss for this month? Can I take it the other month? Should I get the hepatitis A vaccine? For all those questions, you will have answers here. And in case you have any more questions, any further questions, you can leave it in the comment section. I will try my level best to answer it as accurate as possible. Thanks for watching.